Hi, my name is Michelle Kewley and I'm a graduate student at the University of Texas at Arlington. Today I'm going to do a leadership book review in the course Nursing Leadership in Complex Health Systems. The book that I have chosen for this review is If Disney Ran Your Hospital, 9.5 Things That You Do Differently by Fred Lee. Fred Lee was very well known for his ideas and suggestions to improve guest relations. His career began as Vice President of Marketing and Development at Shawnee Mission Medical Center. He then went on to become the Senior Vice President at Florida Hospital. During his time working in the hospital setting, he received many awards for his innovative approach to patient satisfaction and loyalty. Disney reached out to him and recruited him after he was recognized for his guest relations program. I want to also note that his wife was the director of nursing, which he frequently mentions that she was a great resource for him throughout his book. In his book, Fred compares the difference and similarities between senior leadership in the hospital setting and versus being an employee of Disney. By doing so, he challenges healthcare workers to change their approaches and their way of thinking when caring for a patient. For example, the author stresses the importance of empathy when interacting with patients. He reflects on firsthand experiences as well, which is beneficial when trying to understand his perspectives. By simply showing empathy to a patient, it may completely change their experience during their stay and change their perception. His main purpose is to encourage hospital employees to see a new perspective and create a positive culture. Who is this book written for? The book was created for healthcare professionals. He provides a lot of advice for hospital leadership, but he also provides guidance for healthcare professionals of all levels. Although it was written for medical professionals, it may be beneficial to any audience who works in customer service. If Disney Ran Your Hospital is quite an easy read. I found it to be entertaining, and I was impressed by many events that he mentions that I could relate to. For instance, he mentions the importance of following a strict dress code for all days of the week because all patients are important, regardless of which day they seek treatment. Every patient should be allowed to have a great experience and without any risk of a poor perception due to a casual Friday. For any healthcare professional striving to do better, the delivery of his message was positive and inspirational. Most of his ideas and strategies that he suggests in his book were realistic, easy to adapt to, and directly impact patient care in the work environment. Suggestions to improve his book would be to include some updated data. The book was published in 2004, which we all know there have been many changes in healthcare since then. He emphasizes his focus on patient experience. However, due to his book being published almost 20 years ago, it does not address today's barriers in healthcare, causing me to disagree with some of his statements. In today's healthcare, patient satisfaction scores are widely viewed and monitored, which is the opposite of what he suggests in his book, stating that his satisfaction scores were not utilized to improve performance, and most employees were unaware of their scores in most hospitals. Also, his ideas seem great, but they are ideas based more on his previous experiences versus actual evidence-based data and practice. I really enjoyed his book, so yes, I would recommend, especially if you are a Disney fan. Walt Disney World is famous for attention to detail, and the author frequently relates this to the patient's perception during his hospital stay. For example, he explains the use of the nurse intercom. He goes into detail into his experience and how appreciative he was to have seen a nurse in person versus dealing with a loudspeaker, which kept him awake during a previous overnight stay. The intercom or the nurse at the bedside would accomplish the same task, but the author broke down the details of the event that changed his perception. He describes that Walt Disney would have taken away conveniences if it had benefited the overall experience of his customer. It is great for all healthcare workers and those that work in the community to serve people. This book offers a little something for everyone. It is a great resource for anyone interested in viewing life differently and learning how to engage with people from a unique approach. I would say this book met the objectives. Although each person interprets messages very differently, overall, this book delivered a powerful, positive message that was very clear. The author stresses throughout the book that healthcare teams provide experiences like Disney, not a service. He does a fantastic job identifying his reasons to believe this, clarifying that we are there to provide an experience and a place to heal, not to provide a specific service. He offers strategic ways to improve the patient's experience during their stay in the hospital. In summary, this book combines a love for healthcare and the magic from Disney. Although they are quite different from one another, this book identifies how healthcare can benefit from the similarities. Thank you for your time today.